I'm a gynecologist, thanks to my aunt who died in 1999. Why I'm saying that is because we usually say that in this inter-county MPDSR initiative, the only thing that we sell is passion. The only thing that we sell is passion. Passion to save mothers, passion to save children and neonates from dying. So we've been walking this journey for the last 1 year or so. And I want at this juncture to just thank the CEO. The CEO, your passion, we usually assess your passion, and I think you are at 101%. You actually came and overtook all of us as far as your passion towards this is concerned. We really appreciate you for the work that you've been able to undertake. The last just about 4 months, Katra, thanks so much, Katra, for also running away with this. We usually call Katra senior matron, because she actually is a former matron, and she's been able to, may not know, some of you may not know this, but as much as the faith-based organizations in this country have just about 11% of health facilities, but 40% of Kenyans access health services in the FBO space. And that is significant, that is huge. So as we move towards this, Madam CEO, thanks for giving us an opportunity for us to partner with the COG, because we work in these counties where you are. I was just discussing something with the CEC from Meru, and I was telling her that one of our largest facilities, Maua Methodist Hospital, is contributing significantly to the healthcare services in the county. So we are looking forward to further partnerships, and we commit ourselves as the FBO space to work with you to be able to end maternal and neonatal deaths. Thank you so much.
Thank you very much, Daktari, for the passion. Just nothing else other than passion to save life. Allow me now to call Gates Foundation that supports most of other partners. We may not be able to call every partner, but please just feel represented by the few that have spoken on your behalf. So Sam, kindly.
Excellencies, all protocol observed. It is great to be part of this very important day. In the maternal health field, there's this very renowned champion for maternal health who say that the day societies will see the life of women is worth saving, that will be the end of maternal mortality. And I think the very fact that we are gathered here, we all believe that the life of our mothers and our babies is worth saving. And just going back to the story, the driver that Dr. Ganda mentioned, he gave a very nice overview indicating that we've had reviews done. And those reviews tell a story about our health system. And sometimes after those reviews, we could gather and feel very sad about what has happened and what did not happen and what did not happen. Some of those reports have been released in this very hotel. Critical partners working with the ministry really getting this surveillance. But what could we do even more is that follow-on action. After those reports, the follow-on action, so that we actually act on what those reports tell us. And if we could do more on that, then that will also be a way of really ending preventable maternal and newborn deaths. It therefore calls for a very collective effort. All the partners here and those who are not here are very key. It's not a one entity. It calls for everybody. And that's why I think the example of the driver just tells you how we work. So, excellencies, you are so important. You are so important in accelerating this progress. And it's great to see that you've made your time to be here, because this is a very critical agenda. And we are at a very good place as a country to see that the Council of Governors wants to move ahead to end preventable maternal and newborn deaths. The National Ministry of Health and the President wants to go ahead to end preventable maternal health. And therefore, this is quite a great moment for the country, that collectively we can come together to end this problem that has been with us for a very long time. Now, the Gates Foundation is very keen to listen to what priorities countries are having on this matter. Because countries, governments, whether at the national level or at the county level, they set priorities. And therefore, we'll listen to these priorities, and where we can, we are supportive to accelerate the end to preventable maternal and newborn deaths. And that's why we partner with the Council of Governors for many years. In fact, I can say from the very beginning, when we had His Excellency Isaac Ruto as the chair of COG at that time. So it just shows how far we've been together with the Council of Governors and also working with the national government in support of the country's priorities that have been set by the country. And just a few months ago, when Bill Gates stood at the platform of the African Union, he talked about 3 goals that will be key for the foundation moving forward in the next 20 years. Now, if you are told to talk about your 3 goals in life, I'm sure you have so many, even as a person, even as an institution. And try to imagine, among the many goals that the foundation could come out, he zeroed on 3. And the first one he mentioned was the reason why we're here: to end preventable deaths of mothers and moms. That was the first one. So you can imagine. And then the second one was to reduce infectious diseases. And the third one was to lift millions out of poverty. Those are the 3 top goals for the Gates Foundation. And we shall work with our partners across the continent to deliver on that. And the Council of Governors, you're a key partner in this particular journey. Thank you.
Thank you very much, Gates Foundation. Indeed, you've been a constant partner since the advent of devolution, and Your Excellencies, you may need to appreciate that Gates Foundation supports 2 technical staff for the last almost 7 years now, and we are eternally grateful. Your Excellency, before I hand over to the Governor for Bungoma, allow me just say this about one partner that is absent, Chai Clinton Health. Clinton Health is one of the partners that believed in this cause when it was extremely, very, very young. We sat with them and we embarked on a journey to Uganda, and they supported that journey that has actually birthed what you see today. And after that, they've continued to support counties across all the 47 counties. So Clinton Health, we really appreciate your support and believing in this cause and ensuring that you work with us this journey up to today, and believing that we could go and at least appreciate what other countries are doing in as far as bringing these maternal deaths down. We are eternally grateful to you. So without much ado, allow me now bring on a stage His Excellency Emeritus Governor Lusaka to take us to the next program. Welcome, Your Excellency.
Thank you so much, our CEO. I'm Senate Speaker Emeritus. When you just say Governor Emeritus, people may think I'm no longer governor. On a light note, but my distinguished ladies and gentlemen, my colleagues, my duty is very simple. One is to acknowledge the presence of my colleagues and deputy governors from the COG. So allow me to introduce the following deputy governors before I introduce the governors. Her Excellency Christine Kilalo from Taita Taveta. A round of applause. Her Excellency Philomena Kapkori, Trans Nzoia. She's just stepped out. If you saw somebody step out, a lady, that is the one. But when she comes in, I will acknowledge her. Achaule Robert Komole, Deputy Governor West Pokot. Thank you so much. Felix Kiplagat Mayo, Deputy Governor Baringo. That's the one, thank you. Abdi Dagane, Deputy Governor Garissa. Thank you so much. Let me introduce my colleagues. Khalif, His Excellency Khalif, Governor Mandera. We'll be given a chance to say something. Governor Mudhomi Njuki, Tharaka Nithi is our whip, he will say something. And Governor Sang who will also say something, Governor Nandi. I think we're discussing something very critical. Just mine is just to, our position as a council will be given by my colleagues. But I think we are discussing a topic that's very important because preventable maternal health is so important that some of us, most of us here, I'm sure, have families. When you marry your wife, there are moments that are very good, and when she gets pregnant, you also mentally become pregnant. So you move around with the pregnancy together. So you can imagine if that then does not result into what you expected, or you end up losing her or losing the child, then it turns tragic. It's even unimaginable at that point when both of you are feeling extremely happy. So I think that the fact that we are now talking about this and looking for practical ways of addressing is very important. And just like it has rightly been said, there must be that political goodwill from the counties, because we are the heads of the counties, and that is why we are here. Because again, without political goodwill, from the top, like where I come from, where I come from, neighboring, they say fish rots from the head. So if the fish is rotten, there is no fish. If the head is rotten, there's no fish. So we've just come here to commit ourselves and to give that political goodwill to this initiative that is going to see a lot of changes, I believe. And that is why we are here. Just maybe Madam Kapkori just stand so that they know that you are here. That's the Deputy Governor Trans Nzoia. By the way, my deputy is also a lady. So the ladies are taking a very prominent position even in the council. And want to encourage even those who will be coming later to also have ladies as their running mates or their deputies. They add a lot of value. There are things that we cannot talk about as men governors, but there are areas that they will talk comfortably as ladies, especially when they are talking to fellow ladies. I don't want to make this my day. May I now invite Governor, who is reading for Governor Sang. I know there's one who is coming to talk on behalf of the chair. As also a member of the committee. Okay, karibu sana. Tusipoonana hapa tena tukimaliza. Mungu awabariki sana. Mnakaribishwa Bungoma. Tupambane na mambo ya mama na watoto kutoishi. Because we wish them to live, lakini saa zingine mazingara yanafanya hivyo. Asanteni sana. May God bless you.
Thank you very much. Another round of applause for Governor Kenneth Lusaka and also the Speaker Emeritus. So, good morning, everyone. I am here on behalf of our chair, the chairperson of the Senate, Council of Governors Committee on Health. That is Governor Abdulsamad Sharif, who is not here with us, but I'm also a member of the committee. And before I read his remarks or read the speech on his behalf, I want to agree with my colleague, Governor Lusaka, that what we are discussing here today is very critical, very important, and close to our hearts. We just had a small discussion at the waiting lounge before, as we were waiting for this meeting to start. And some of the discussions that we had there, as governors, you have several low moments in your life as a governor. Specifically for myself, the lowest of the moments I have had are situations discussing a matter of this nature. As a politician, sitting down and discussing the loss of a mother or the loss of a newborn has been one of those very difficult moments for me. And I shared with the team who are with us at the waiting room of 2 or 3 occasions that I had serious discussion around the circumstances under which we lost a mother or a child. And in one particular case, I was on phone call with the medical superintendent of the facility, and as I tried understanding what, reviewing the matter, he tells me, there was Dr. So-and-so. I tell him, let me add Dr. So-and-so onto the phone call. After another 2-3 discussions, I had to add another person, and by the time we were done with the meeting, we had a conference call of about 7 people. But still, nothing, I still felt that we were not, I wasn't really, I didn't understand. At the end of the conference call, I still could not understand how we lost the mother. It's even more difficult when you now decided to go and mourn with the family. And in a whole 3 or 4 hour funeral, the whole discussion is about how we got there. Today, I am happy because the platform that we are launching today gives you an opportunity to have every discussion about every death of a mother, of a newborn. And not just a discussion that is not, properly contextual, but you're having discussion that, as the chair of the caucus did indicate here, is about ensuring that it's not just about that facility or that mother and that child, but lessons can be picked for across the county, across counties, and across our republic. And once you have a situation where every medical professional knows that every death of a mother or a baby has to be discussed, reviewed, reasons given, that in itself, even before you look at the benefit of, picking up the lessons learned, the fact that you are going to have to give an account for every death of a mother or a child. In its way, in its own way, as a deterrent capacity. It has the impact of ensuring that we bring down that. And not just about the deaths, but also the near misses. I think the word was the near miss. Because also, you know, we have had situations where one or two critical actions end up helping us not to get to the point of death for the mother or for the child. So this is very personal for us, and we want to thank the COG Secretariat for for developing this program, and thank all our partners who are supporting us in this initiative. I can tell you, we may be few as governors here, but the commitment of the 47 county governments, and not just county governments, the commitment of ourselves as governors in our individual capacities, not just to oversee or allow our CECs to chair those meetings, but for ourselves to sit into those meetings on weekly basis, is a commitment that I can give on behalf of our colleagues. And we will push that to ensure that in those forums, whether it's going to be weekly, together with, and we agreed, a monthly report given to you on your desk does not speak much. It's just part of the statistics. We cannot allow the lives of our newborn and our mothers to be just mere statistics. We want to discuss them one by one and ensure that we take responsibility right from the top and ensure that we are able to bring down this. It's embarrassing when you hear that our neighbors who may not be doing as much as well as ourselves in terms of resources, in terms of facilities, in terms of human resources, in terms of, name it. But then they have managed to crack this up. I tend to believe that the gap has been the platform that we are launching today. Thank you very much. And I allow now that I am able to proceed to just read the remarks of our chairperson. Colleague governors, development partners, civil society organizations, the faith-based organizations present, the private sector, national and county governments, officials present, ladies and gentlemen, good morning. It is a great honor to host you all during this momentous event as we officially launch the Inter-County Maternal and Perinatal Death Surveillance and Response Initiative. Today's gathering is more than a launch. It's a powerful affirmation of our collective duty, our shared resolve, and our unwavering belief in the right to life and the right to health and the dignity of every woman and newborn in all our 47 counties. Ladies and gentlemen, Kenya continues to face an urgent challenge. Our maternal mortality ratios remain above the SDG 3 target of 70 per 100,000 live births. And the neonatal mortality stands at 21 per 1,000 live births. While progress has been made, these statistics remind us that too many mothers and babies still die from causes that we know are preventable. Behind each number is a family profoundly affected, a community shaken, and a future cut short. We also know that the MPDSR is one of the most strategic and transformative interventions for reducing these deaths. Counties have invested significantly in maternal and newborn health through improved staffing, strengthened emergency referral systems, facility upgrades, and enhanced community-level services. Yet the implementation of this response has remained uneven, limited to times by systematic gaps, weak feedback mechanism, fragmented learning loops, and insufficient inter-county coordination. Ladies and gentlemen, the Response Initiative has been a cornerstone in our county's effort to address preventable deaths amongst our most vulnerable population, that is our mothers and our newborns. Notable successes has been realized through activation of MPDSR committees, as evidenced by our facilities such as Kiambu Level 5 Hospital, which in 7 months reported 0 maternal deaths through the initiative. Others include several public hospitals in counties such as Machakos and Homa Bay. Despite the successes realized by county governments through prioritization of health has demonstrated by investment of an average of 30% of the resources received by the Exchequer in the health departments, the following challenges persist. Number one is limited health financing for county governments from the Exchequer, coupled up with donor transitions in strategic disease programs. Number two, the transition from the Linda Mama program to a more complex SHA system has restricted access to maternal health care services. Further, a significant number of primary health care facilities are yet to receive their PHC funds. Thirdly, the directive restricting deliveries to facilities with inpatient beds threaten to undermine the progress made in increasing skilled deliveries, putting maternal and newborn health gains at risk. On digitalization of health services, the process has been gradual, and as such, some county health facilities, more so the primary health facilities, are still yet to start claiming from SHA. On matters of human resources for health, there is a shortage of specialists for maternal and newborn health, with skewed distribution of the available specialists across counties, as well as the perennial menace of industrial unrest. There exist data and research gaps in maternal and newborn health, and also the cultural and social barriers affecting access to health care services, including limited optimization of community health systems. To address these challenges, all stakeholders need to invest in strategic interventions that strengthen both supply and demand sides of the maternal and newborn services. In addition, both the national and county government should work hand in hand to strengthen primary health care system, ensure equitable distribution of skilled health workers, and increase domestic financing for maternal and newborn programs. Development partners, civil society and private sector, on the other hand, can complement government efforts through targeted investments in infrastructure, training, innovation, and health service delivery models. Ladies and gentlemen, in conclusion, the Council of Governors envisions a vibrant and interlinked community of practice where knowledge flows freely, the root causes are interrogated, innovations are scaled, and cross-county linkages are intentionally nurtured. Beyond boundaries and beyond soiled responses, this forum represents a new chapter, a unified, coordinated approach to preventing maternal and perinatal deaths, and further, the initiative brings visibility to cases that fall between counties during referral processes, restoring accountability that transcends administrative lines. Our goal remains simple yet profound. No woman, no newborn should die from preventable causes. Your presence here today reflects a shared commitment to strengthen MPDSR and advancing high-impact solutions that can save lives. The tools and the products we are launching are on this day are designed to improve the data use, standardize practice, enhance coordination, and accelerate timely, actionable responses to maternal and perinatal deaths. The Council of Governors remains fully committed to supporting the momentum needed to deliver meaningful change. Let us move forward on a united but a common goal of ensuring that preventable maternal and newborn deaths become abnormal. Asanteni sana. It's now my humble pleasure to invite my colleague, Governor Mandera Khalif, to make a comment, and then in turn invite our whip, who is here representing the chair of the Council of Governors. Karibu sana, Your Excellency Khalif. Governor Mandera, make your remarks and then invite our chair. Karibu sana.
Asante sana, Your Excellency. Ladies and gentlemen, I would like to take this opportunity to thank Council of Governors Secretariat for organizing this program. When I came in and looked at today's program, I think the most catchable word there is preventable maternal and newborn mortalities. So we just need to underline that word. It is preventable. So as a governor who comes from one of the rural, or we call marginalized counties in this country, health is actually the area that I focused on just immediately I was elected to the office. I can say under devolution, we have made a huge progress. Just to give you an insight on the Mandera County, at the onset of devolution, we had 126 health workers across the district then, now what we call Mandera County. 126, serving a county of 26,000 square kilometers. Serving also the neighboring countries of Somalia and Ethiopia, because health has no boundary. But today we talk about 1,600 workforce. From 126 to 1,600. So when some people talk about centralizing health, for those of us who come from northern Kenya or even the country, we just laugh at them, because many people don't know what we have achieved under devolution. We had one medical officer, one, in March 2013. And today, we have over 60 medical officers and over 17 specialists. So even with that number of improvement, we are still talking about preventable maternal and newborn death. Of course, in our cases, it's a bit different, because even referrals, when we are talking about referring a mother, we are talking of 100 kilometers and plus. You know, when we are talking about 26,000 square kilometers. So this program is actually very close to my heart when we talk of this particular one. That's why I traveled from Mandera yesterday to attend this meeting. The chairman, Dr. said, even with the huge investment, the indicators are going down. Then we ask ourselves, why? Simple example. For us in Mandera, a dispensary is a very important facility for us. Dispensary, the border of Ethiopia in Mandera North or in Mandera West is Agagan and Nairobi Hospital of Mandera. Now when you deny deliveries at the dispensaries and health centers, that is level 2 and 3, where actually in the last 2 years we have constructed over 27 new dispensaries. Our priority, our demand is huge. We thought SHA thing will work. What we did this financial year, we invested more in equipping our hospitals, hoping that the money or the resources we'll generate will also support us in issues of farms and non-farms. But when a referral, county referral hospital receive 1.2 million shillings of disbursement, then you can imagine what we are looking at. Having said that, as Council of our Governors, we're going to support this program. This program is not competing with Ministry of Health. I think the chairman said it very clearly. Health is a default function, and there's no citizen for national and county government. We are just serving one community. For us, this is a very important program. I have been thinking about this particular issue of maternal and newborn death. But when I heard of this program, I was really excited, because it does not only tell us how we are faring, but we can even do knowledge transfer from the other counties. So ours is, I just want to take this opportunity to confirm that we're going to support this program, and we're going to be the champion. We'll be attending this meeting, and God willing, this indicators will improve. Thank you very much. You know, at the Council of Governors, I'm a very junior man, so I've not been used to inviting the chair. So I just want to take this opportunity to thank His Excellency Governor Duke who is also our whip, to come and make remarks on the behalf of the chair.
Thank you very much, Governor Khalid. Even those who hold positions in the Council of Governors, it's just service. They are just first among the equals, and all governors are equal at the Council of Governors by all means. My colleague governors who have afforded to be here today, we are the Speaker Emeritus Governor for Bungoma, Chie Lusaka, Governor for Nandi County, who is also a member of the Health Committee and shares resource mobilization. It's one of the reasons why we're here. And a very committed member of the Health Committee, Governor Khalid of Mandera. Our development partners, who I'll not mention each by name. Our deputy governors who are here, each one of you representing your county and your bosses. The caucus of the CECs, headed by the chair, who just spoke very well. The Council of Governors Secretariat, headed by CEO. The MPDSR team, headed by Dr. Mary Maina. Everyone in this room, good morning, and how are you doing? I just wanted to hear that response because we are meeting in one of those very rare occasions when we discuss issues pertaining to the voiceless in this country. I want to associate myself, before I read the speech for the chair, with the comments that have been made by my colleagues who have just spoken very well at the position of the council. And I want to tell you that this function was so serious that every governor would have been here, and especially the chair of the Council of Governors, Governor Ahmed of Wajir, and also Governor Abdul Samad, the new chair of Health Committee of the Council of Governors, and you're wondering, how can such a serious affair be missed by the governor for the first time? And I want to make it very clear. And I want you to put yourselves in their feet or in their shoes. Before you are a governor, you are a politician. It is the politician that makes the governor or brings the governor here. So today, we are here, the few of us here, courtesy of Section 2A that was repealed in 1991, when we used to be a one-party state. And it was repealed. Now we are very many parties in Kenya. One of the front runners as a party in this country, which is very, very popular and holds most of the leaders, is ODM, which you know very well. ODM is having their celebrations of ODM at 20 in Mombasa, starting from today to Saturday. The governor of Mombasa is the host, and therefore he is there today making his opening remarks to welcome the rest of the country. The chair of the Health Committee at the National Assembly Dr. Nyikal sits in the neck, and I therefore also want to take his apologies, just in case you're thinking that the National Assembly bolted from this. They are with us here. But Dr. Nyikal also sits in the neck. Catherine Muma, who was also supposed to be here, Senator Catherine Muma, is a front runner. She also sits in that governing body for ODM. I don't really have to preempt that Governor Ahmed, who is our chair of Council of Governors, is one of the leaders in the neck of ODM. And therefore, they are there doing what made governors, and we are here because we belong to the other faction, courtesy of the promulgated constitution, representing them. So that it is clear, I don't think we are bolted. I'm also, I have a feeling that also the ministry could also be supporting that function somehow. That is why they are not here. Before I read the comments of the chair, allow me to pick from where Governor Khalid left. On the issue of SHA, eliminating the dispensaries as one of the centers that we can allow our mothers to give birth and be paid by SHA. There must be a reason behind everything. And one of the reasons why, when I engaged the SHA and the CS, is that officially dispensaries are not supposed to be inpatients. And therefore, to curb fraud, they decided the dispensary should not be recognized as a place where a mother came in, gave birth, and left after 3 days. You would imagine that we gave birth and then just sat on the benches for 3 days and left because there's no bed capacity. And surely, and the minister is represented here and we recognize you, you can fake any other disease, but I don't see anyone faking pregnancy. Because pregnancy has a product that are visible, which is a baby and a happy mother. And therefore, we seriously need, as Governor Khalid has said, for the ministry and SHA to reconsider that position, because they say that it is in the law, and I believe that law was not made, man was not made for the law. It is a law that was made for man, and therefore they have to change that because it is completely not working, and that is why those healthy indicators are coming down. Then allow me also to say that in African culture, being blessed with a baby, and we always advocate for giving birth in facilities where we have experts who will midwife the coming of the baby as compared to traditional births. It is one of those conditions that take you to the hospital and you're not sick. In African culture, it is normally a blessing. Even if you ask them, where is your mother today? Or where is your auntie? Or where is your wife? That she went to the hospital to be blessed. Not to be attended to by doctors and be cured of a disease. And therefore it is a blessing. So when the mother goes home mother goes home without a baby, there's no blessing. When the mother does not even go home, and in her own life, she goes home in a coffin and the baby, then that turns the celebration to tragedy. It is like a wedding ceremony that has been turned into a funeral ceremony. That is how serious it is. And therefore, we are here today to assist this very noble cause to be advanced in Kenya. And I want to thank those who started it, headed by Dr. Maina, because like H.E. Khalid put it, mothers have no boundaries. You can do very well in your county, but the mothers from neighboring counties who end up in your hospitals and they did not have any follow-up, or they did not have the assistance to get there, and they're not in your records, and no one has taken the initiative, if your county is doing very well and the neighboring county is not doing very well, we'll definitely end up where we do not want to be, or worse than where we are at the moment. And therefore, it is a noble cause that we are looking forward, that it will take place, or rather it will be implemented in all the 47 counties of Kenya, so that as a country we can succeed. Allow me now to read the speech of the Chair of the Council of Governors, Governor Ahmed, Governor of Wajir County. It is a great honor to join you today for the launch of the Inter-County Maternal and Perinatal Death Surveillance and Response, which is called MPDSR. This initiative is a landmark moment in our shared commitment to safeguard the lives of mothers and newborn across Kenya. On behalf of the Council of Governors and the 47 county governments, I sincerely appreciate the Minister of Health, our development partners and implementing partners, and all the stakeholders for their unwavering support in strengthening maternal and newborn health systems across the counties. Improving maternal and newborn health is not only public health priority, but also a strategic economic investment, as healthy mothers and children are the cornerstone of productive families and resilient communities, and they contribute to a stronger national economy. Ladies and gentlemen, for 13 years now, devolution has provided counties with the opportunity to prioritize and invest in maternal health. Counties have made remarkable progress, which is evidenced by the following. Counties have involved, or they have partaken to construct and equip modern maternity and newborn units that are rising in number in Kenya every day. Expanding community health system to ensure early identification and referral of pregnant women, recruiting and training skilled birth attendants, strengthening emergency and obstetric and newborn care, integrating MPDSR process into county health plans and accountability frameworks. These efforts have translated into improved access to skilled delivery, enhanced data-driven decision-making, and in some counties, notable reduction in maternal death. For instance, Kiambu Level 5 Hospital reported 0 maternal deaths in a span of 7 months following consistent MPDSR reviews. A testament to what collaboration, accountability, and commitment can achieve. Similar successes have been noted in counties such as Machakos, Kisumu, and Homa Bay. And just to know that successes sometimes, which are headed by the politicians, faces resistance. You may have noticed a lot of activities around Machakos and Kiambu in those who are trying to somehow camouflage, or they want those particular successes not to be noticeable. However, despite these notable achievements, several challenges still remain in the counties that are grappling with inadequate financing resource constraints, particularly as donor transitions have impacted health, and because we have heavily relied on donors, and we are aware of what political decisions sometimes can do when it comes to pulling out of the donors. Shortages and inadequate distribution of skilled personnel, especially specialists, weak referral systems, and limited emergency transport, socio-cultural barriers that hinder timely access to care, gaps in data and research for decision making, and insufficient psychosocial and mental health support for mothers and health workers affected by adverse outcomes. Ladies and gentlemen, to address these challenges, we must innovate and collaborate. Both levels of government must work together to strengthen private healthcare systems, ensure equitable distribution of skilled health workers, and increase domestic financing for maternal and newborn health. At the same time, development partners, civil society, and the private sector must continue complementing these efforts through investment in infrastructure, training, and technology. The launch of this MPDSR initiative comes at a pivotal moment as the country advances conversation on ending of preventable maternal and newborn deaths through every woman, every newborn, everywhere, abbreviated as EWENA, which I would risk calling EWEN. Acceleration plans of 2025-2027, in which counties have played a central role in shaping development of this plan. Ensuring that every investment made translates into real improvements in maternal and newborn outcomes. I think I like this. Every woman, every newborn, everywhere. And I think that it should be a mantra that should stick to your head, to our mind when we leave this room today. This MPDSR investment case we are launching today serves as both an advocacy and resource mobilization tool. It outlines priority interventions, implementation of frameworks, and the resource requirements to strengthen surveillance, review responses, and learn at both the national and county levels. The return on these investments that you're trying to initiate today, and learning at both the national and county levels. These returns will be measured not only in lives saved, but also in strengthening data and use improve service delivery and enhance public trust in our health systems. Ladies and gentlemen, in our effort to improve maternal and newborn health outcomes, mental health remains an essential and inseparable component. Someone mentioned earlier, a mother who was miscarried or has not born with a baby, which is part of the blessing, cannot be mentally the same as when they went to that hospital. And therefore, we are dealing with a lot of mental cases that is related to this. And that is why the Council of Governors has continued to champion mental health as a very key pillar of maternal well-being. We have supported the training of health workers in mental health and psychosocial support. We have nominated frontline health workers as a county representative, that is COG's representative, to the Kenya Mental Health Board to ensure counties' voices are represented in national decision-making and encourage counties to integrate counseling and psychosocial support services for mothers and families who have experienced tragedy during childbirth, as well as for the healthcare workers involved in such cases. It is important to me to note in this case that one of us who was the champion of starting this, and that is Dr. Mary Maina, who is here. Dr. Maina, you can be upstanding. This is our representative. This is our representative in the board of mental health board in Kenya. Thank you, Dr. Maina. You can have a seat. Moreover, the Council, through the inter-county MPDSR platform, continues to coordinate learning and sharing across counties. We have embedded MPDSR information on Council's website and will continue hosting a series of engagement to sustain momentum in preventing maternal and newborn deaths. Ladies and gentlemen, this initiative reflects our unwavering commitment to universal health coverage, and by reducing maternal and newborn mortality, we move closer to achieving the goal of quality, accessible and affordable health care for all. The estimated 5,680 maternal deaths and 33,600 newborn deaths annually are more than statistics. These are life lost. Families are devastated and communities are left in grief. Together, we have the responsibility and opportunity to change this narrative. As we launch the MPDSR initiative and investment case today, I call upon all partners, stakeholders, and both levels of government to support its full implementation. Let us strengthen accountability, invest wisely, and work collectively to ensure that every mother and newborn not only survive, but also thrives. Finally, as I conclude, I wish to sincerely thank our frontline health workers in the county health teams and all partners who continue to champion this cause. The Council of Governors remains fully committed to working with all stakeholders to direct resources where they matter most and to ensure that the preventable maternal and newborn deaths become a thing of the past. Let us remain united in purpose, innovative in approach, and compassionate in actions as we build a healthier and more resilient Kenya for generations to come. Thank you, and may God bless you. And as I leave this podium, it allows me to borrow from politicians, because we like it or not, they run the affairs of the world. It is because of our politicians today that we do not have the frontline workers who are in the program that was supported by USAID a few years ago. We like it or not, leave alone in Kenya. In all over the world, it's politicians who run this. And I've never seen such a resilient class of human beings as politicians. You have seen politicians win elections by working with enemies. People you thought that they can never talk to, but they realize this is the medicine to my disease, because my disease is failing to be what I want. And as bitter as it is, I need to talk to these guys so I can be able to win. And therefore they crafted a quote that says that you should never die out of a disease which has a cure that is known, which is affordable, and which is available, unless you're a fool. That is why they will work with enemies to make sure they succeed. And I'm just wondering, the newborn death and the mothers, maternal and perinatal, is it a disease that is known? Does it have a cure? Is the cure available? Is it affordable? Then why are they dying unless we are fools? We have to make sure that we have to work on it with the resilience of the politicians so that we can be able to save their lives, and it is possible. Thank you very much, and may God bless you.
We can do better than that for the governors that have spoken. I think the message is clear and it sits well with us. For the first time, there's a best practice to borrow from the politicians. So I think moving forward, that should be the practice. And I've said for the first time. Now, Your Excellencies, allow me go straight now to the gist of this. We said that we have 4 agendas, the objectives, and one of it is from the duty bearers, the people that sat together to ensure that we are here today. So we would want to hear the inter-county initiatives, the voices from the frontline health workers that will be presented by Dr. Mary Maina. Karibu sana, Daktari.
Excellency Governors, all protocol observed, ladies and gentlemen, good morning. It's very difficult to speak after Governor Muthomi because he knows I started my medical career in Tharaka Nithi, but that was before devolution, so I left just before devolution came. I feel like our work is done. We dreamt of a day that politicians would talk about maternal and newborn deaths, and not just talk about them,